corruption, right? The corruption is because they don't want you to use off-label, repurposed generic medicines. It does not provide profit to the system. And so that early treatment and its efficacy and the availability is being suppressed. What happened in this country, and I have to call it out, is, again, I use the words absurdity and obscenity, but these are crimes. You know what's going on in this country right now? Is that the CDC has been captured by the pharmaceutical industry. They sent out a memo in August of 2021. They sent out a similar memo back in the spring of 2020, telling the nation's physicians and pharmacists not to use generic medicines. We are now in a state in this country where Senator Johnson asked the question, how can we get the average US citizen to treat or get treated? We have pharmacists across the land who are refusing to fill these because they've been manipulated and brainwashed into thinking that the FDA hasn't approved the use, as if that matters. Off-label prescriptions and prescribing has been going on for decades. It's encouraged when there are no effective treatments. Yet I have to, when I try to treat my patients, and Dr. Marble can attest to this, we have pharmacists who refuse to fill some of the safest and low-cost medicines known in the history of medicine. Dr. Marek talked about that. These are extremely safe, extremely low cost. They do not provide profit. The CDC has intervened and have manipulated the doctors. I need to make that message clear to all physicians in the land. These are highly effective medicines. They're not being used. The pharmacists are not filling. All the pharmacists in the land, you have to understand that you are obstructing the good and sound conduct of medicine.